Okay, we are closing in on 7 o'clock. I see a lot of people signing in as I'm speaking. Welcome to our Wednesday Wellness for Women, Behavioral Health, Coping with Anxiety and Depression. Wanted to remind everyone that your microphones are automatically muted. Your videos are automatically turned off. This is intentional as we do have several, actually just over 1,000 women registered for this event tonight, and to keep everybody protected and also to allow for a smooth presentation, we do have video and sound turned off. If you have questions for the presenters this evening, please post them in the chat. We have allowed time for question and answers at the end of tonight's presentation. Tonight's presentation is being recorded, so if you would like to review it and go back following the event tonight, you will receive an email with a survey as well as information on how to access tonight's recording. With that, I think, Dr. Archer, we can go ahead and get started.
Great. All right. I'm going to advance the slides here, guys. This is the first time I've done this for such an audience at home. So we've had meetings, but thank you, everyone. Good evening and welcome. I am honored to be speaking tonight about such a sensitive, emotionally pressing topic, especially in the current world we are living in. I heard there may be just a few hundred of you, 1,000 out there, listening and or watching. Wow. I heard, hopefully when Kassandra and I heard these numbers, we thought no pressure, of course, and our anxieties rose. So it's the perfect conversation for this. But we are happy to both be here tonight. Hopefully we'll make it worth your while. I am proud to be here with Kassandra Maple. She's an amazing colleague of mine who is the shining star of our behavioral health program in the OBGYN department at IHA. Although I'm not a psychologist, psychiatrist, therapist, or social worker, I do play one daily in my obstetric and gynecology practice. I've been invested in this topic while growing as a physician and strongly involved in developing and supporting our behavioral health program. I'll be talking the first 20 minutes and I'll let Kassandra take over, so stay tuned. She's going to have some great coping strategies and mental exercises to share with us all, free of charge, of course. So I'm trying to advance my slides, Kelly. Let me see if this goes here. Great. Okay. So topics, or real quick, sorry. There's a bio of me on the page here. So I have been in practice with IHA for about 15 years now. I am practicing currently out of downtown Plymouth, and I practice out at Domino Farms as well. I will be at a third site starting this month at the IHA Livonia site near Schoolcraft Community College. So a little bit about myself there. The topics we're going to discuss today, or I'm going to discuss, is I want to briefly talk about facts about anxiety and depression in women, stages of life and its effects on mental health changes through a world pandemic, screening for anxiety and depression from an office standpoint, and then prevention and treatment of anxiety and depression. So I would like to think of this talk as one avenue for understanding women's mental health so we can continue to evolve through life's challenges, especially in the world we have seen. I feel and believe that with women's mental health, more knowledge is power. Quote here by Marie Curie, "Nothing in life is to be feared, it is only to be understood. Now is the time to understand more so that we may fear less." So some facts about anxiety and depression. A little history and an interesting fact, actually. Hysteria was the first mental illness ascribed to a specific body organ, the uterus or hystera. Ancient Greek physicians believed that otherwise inexplicable paralysis and deficits were caused by the rovings of an unmoored uterus from its place in the pelvis. Really, a roaming uterus? Although the oldest record of hysteria dates back to 1900 BC, when Egyptians record behavioral abnormalities in adult women on medical papyrus. So see, ladies, we were doomed from the start. No, seriously, why are we talking about this topic today? 1 in 5 Americans struggle with mental illness. And in the last year and a half, that's probably gone to 1 in 4. Because in 2019, 51.5 million adults aged 18 or years age or older were diagnosed with mental illness. The prevalence of mental illness is higher in females compared to males, being 25% versus 16%. Young adults have the highest prevalence in women at 30%. We know women are 40% more likely to develop depression, 2 times more likely to be impacted by general anxiety disorder and panic disorder, and 2 times more likely to develop post-traumatic stress disorder. So why is this? We believe it's a combination of physiologic and cultural differences that play a role. Serotonin, which I'll mention later in the talk, is a neurotransmitter in our brains that is lower in women compared to men. We also know that women have more estrogen in their bodies compared to men, and those estrogen levels change throughout a woman's lifetime. We also know the internalized or self-stigma of seeking treatment for mental health is greater among women, especially those of color. I want to change over here and talk a little bit about the stages of life and the effects on mental health. This next slide's a little busy, everyone, but it has some important information. So looking at the slide, it talks about risk factors and comorbidities of major depression in women across the lifespan. The top portion of the figure shows risk factors in the top sphere, shows in the bottom sphere comorbidities, and then overlapping in the middle are both risk factors and comorbidities for women of all reproductive ages. And then when you look at the bottom half of the slide, it goes through the different life stages. We know these critical periods or windows of vulnerability are specific periods along the life course when adverse events or exposures have the greatest negative impact on women's mental health. These vulnerable periods are when reproductive hormones and psychosocial circumstances are in flux. If you look at adolescence, the risk factors include somatic symptoms, unintended pregnancy, along with comorbidities, body image disturbances, eating disorders that can all be linked with rapid subsequent pregnancies, sexually transmitted infections. We know adolescence is a period of social transition and a high risk period for behavioral and emotional disorders, which can then sadly lead to higher risk of educational underachievement, unemployment, early adulthood and anxiety disorders, nicotine dependence, alcohol abuse, and suicide. Mood disorders in pregnant and postpartum women have tremendous public health impact due to effects on children and families. If you look at the reproductive age in the middle of this column here, we see lack of social support, interpersonal violence, premenstrual dysphoric disorder, which I'll talk a little bit more about, polycystic ovarian syndrome, recurrent pregnancy loss, infertilities are all risk factors for depression that then can be associated with endometriosis, chronic pelvic pain. Premenstrual dysphoric disorder, or PMDD, I like to think of as bad PMS when I talk with patients, has a prevalence rate of 8% in menstruating women, is a major risk factor for depression. I talk about this probably multiple times a day in the office with patients. If we look at the last life stage here, that's on the screen, not last life stage in general, but menopause transition. Late menopause transition is on average 2 years before the final menstrual period, is also a time of increased risk. And you can see that the risk factors include, again, history of premenstrual dysphoric disorder, history of postpartum depression, insomnia, okay, which we know perimenopausal, menopausal, lack of sleep is a great complaint of women, from hot flashes, just in general, I think from the hormone changes that women have. So as you can see, as we go through the stages of life, there are different risk factors, but we continue to be at risk for depression. All right, I'm gonna switch now from a more personal level to a global level, okay? Jumping into discussing the mental health changes that we have seen with the COVID-19 pandemic. Looking at this next slide here, this was a piece of art that was done by an Indian origin artist. On the slide, if everyone can't see it or if they're just listening, it says, being happy every day is hard work. So the slide, I think, is a beautiful piece of art, especially in a world when a virus so rudely invaded our lives, disrupted our normal routines, our families' lives, our jobs, while isolating us and putting our lives at risk. This beautiful piece was displayed for World Mental Health Day, which was October 10th this past year. This was a global online advocacy event that brought together world leaders, celebrities, advocates to call for increased mental health investments in the wake of COVID-19. Just prior to this event, the WHO, or World Health Organization, showed that COVID-19 was disrupting mental health services in 93% of countries in a survey that went out across the world. 67% reported disruptions in counseling and psychotherapy, and 30% reported disruptions in medications. These statistics are saddening, but on a positive note, 70% adopted telemedicine to overcome disruptions, which is quite impressive. I know Kassandra did 100% of virtual visits taking care of patients through this pandemic. Studies show that every $1 US that we can spend on evidence-based care for depression and anxiety returns $5. So from a global and world perspective, it's necessary. I'm going to go on to this next slide here that is actually going to put you guys to work, and I hope this really works. So I want you to share your feelings with me a little bit, and I want you to, there's two ways you can do this. You can respond by the web link, or you can go through and do a text, and it's right up here on the screen. I also have it in the chat so people can see it in the chat, but I'd like people to give me a word that represents how they have felt during the pandemic or what the pandemic has meant to them. We did a couple test words. 2 are from my children here. Okay, I asked them to put in a word. So I'd like you to test this out and put in some words for me, guys, and we're gonna probably come back to this. We'll see if this works, okay? It looks like it's working, so I love it. The more people that put in the same word will get larger and larger in the screen. So I'm gonna keep talking while these words pop in, everyone. So the CDC this last year surveyed 5,400 adults greater than 18 years of age and older across the United States. And during this pandemic, 41% reported at least one behavioral health condition, including anxiety and depression, PTSD related to the pandemic,
I apologize. We have lost Dr. Archer's audio. Bear with us one moment.
So unmute yourself. You're still muted, Sue.
all right. I think I'm back on, right?
Yeah, so I just want to tell you, people are also putting in the chat words as well. So
Okay.
your word cloud is for you to be aware of that as well.
Thank you. Okay, so I'm going to go back and share my screen here. I think we should be okay. Can you guys, okay, let me go back to where I was. Sorry, everyone. I don't know if that poll was working so hard that it got us caught up here, but I wanted to quickly look at these words real quick. It's not quick. Sorry, people. All right. I'm getting there. Okay. So if we look at some of these words that came in, look at how the pandemic has made us feel. Remember what I said, knowledge is power. Sharing your feelings and being aware that you are not alone can give us power to make a change and improve our mental health. Scared, sad, worried, anxious, overwhelmed, tired, definitely. I think thank you guys for sharing. And I know you put some in the chat as well, and I appreciate that. And we'll try and get them in here maybe, and we can look back at the slide at the end here. All right, I'm gonna keep going for time purposes. So let me move on. Okay, I'm gonna switch out of talking about the pandemic and go to screening for anxiety and depression from an office level.
So I wanna make you aware of something. We can't see your slides.
Oh. Okay, guys, sorry. Hold on. I'm getting my tech support here at home to help me here. There. Okay, I'm working on it. I'm working on it. Thank you to my lovely tech support. Okay. All right, so we're gonna move on, guys. I hope you can see my slides now. I'm sorry about that. So screening for anxiety and depression. So all primary care physicians and obstetrics and gynecologists can help in the battle against mental illness by screening for anxiety and depression annually at your checkup, your annual exam, your gyno appointment, whatever you may call it. The United States Task Preventative Force especially recommends screening for depression at least once during pregnancy and the postpartum period as well. We actually know postpartum anxiety is more common than depression, and at IHA, we additionally screen for anxiety. So the next couple slides just give us some screening tools. I'm going to kind of go through these a little fast just for time's sake. These two screening tools, one is for depression and one's for anxiety. This first one is our depression screening tool that we use in the office. It's called a PHQ-2. It has only 2 questions. That's why it's PHQ-2. And answering these questions based on over the last weeks, how often you've been bothered by any of the following problems. Based on your score, if you score 3 or over, we give you another questionnaire called the PHQ-9, which I did not put up on the slide, but it has 9 questions. And based on that score, we then look to see if you're at a risk for depression. If anyone has a score of 5 or greater, that's when we start to think about it. And we will proceed with how can we help as a physician? What can I do, to make these symptoms better for you? The next questionnaire is an anxiety screening tool called the GAD-7. It is 7 questions and has also over the last 2 weeks, how often have you been bothered by the following problems? And some of the questions, not being able to stop or control worrying, trouble relaxing. Based on this score, we look at if you score over 5, then we consider either mild anxiety up to severe anxiety. So when I see this scores with patients, when they fill this out, if they're under 5, I don't typically worry and I'll say, oh, it looks like you're a little anxious here. Is this something we need to think about? Or if they score over 5, I'll address it differently and we'll talk a little bit more in detail and figure out what we can do to help with these symptoms. So these are the 2 screening tools we use. Hopefully you have gotten them at some point in one of your visits. And Kassandra will go a little bit more into other screening tools as well when she talks. Okay, I'm gonna move on to prevention and treatment of anxiety and depression. So we know, of course, exercise is good for our bodies, right? It's good for our heart. It's good for diabetes. It's good for lots of physical health concerns that we may have, but we also know it's good for mental health. We know that aerobic exercise, including jogging, swimming, cycling, walking, gardening, dancing, are all proven to reduce anxiety and depression. The improvements are due to exercise-induced increase in blood circulation to the brain, specifically the pituitary adrenal axis. The HPA axis communicates with the regions in the brain, including the limbic system, which controls motivation and mood, and the amygdala, which generates fear, in response to stress, and the hippocampus, which plays an important part in memory formation. So all these big brain words, what's most important is that you know you only need 30 minutes of exercise a week, 3 times a week to help, okay, to get the beneficial effects of physical activity, which we have seen being distraction, which is obvious, self-efficacy, social interaction, cognitive function, improved sleep, increased libido, increased energy, and weight reduction. Along with exercise, we know diet can play a part with mental health. Our brains are working 24/7, even when we're asleep. It requires constant supply of fuel. I'd like to believe that our brains are important organs, so we need premium fuel, thinking about high quality foods that contain vitamins, minerals, and antioxidants, which can nourish and protect our brains from oxidative stress or the free radicals that damage brain cells. What we want to avoid is processed or refined foods. For example, diets high in refined sugars are harmful to the brain. They worsen your body's regulation of insulin, promote inflammation and oxidative stress. Furthermore, multiple studies have found correlation to worsening depression. So mood and food are intimately related, everyone. That is the moral of the story here. Serotonin is a neurotransmitter in our brain that I talked about earlier that actually helps to regulate sleep and appetite. It mediates moods and inhibits pain. And 95% of serotonin is actually produced in our GI tracts. And those neurons that line your GI tract help guide your emotions. These neurons are protected by good bacteria. Good bacteria, we can see more in a Western diet than a traditional diet. So I'm sorry, a traditional diet versus a Western diet. So traditional diets, okay, is what we want to aim for. Traditional diets have high in vegetables, fruits, unprocessed grains, fish, seafood, modest amounts of lean meats and dairy, minimal processed and refined foods and sugars. Studies comparing diets showed risk of depression was 25 to 35% lower with traditional diets. All right, so besides diet and exercise, we also need a support network for mental health. And that doesn't just have to include humans, it can be non-humans. I could definitely not get my 2 teenagers to get their photos up on the screen, so I have my 2 pets here. We know along with non-humans, we need volunteer activities, support groups, and virtual opportunities to help get us through and help improve our mental health, especially in this last year. We know the virtual opportunities with our Zoom meetings that we've done, with our games that we've played, with our internet friends that have all helped us get through the last year and a half. Next, real quick, I'm going to cover some medication for anxiety and depression. And I'm not going to go into detail because we got to keep moving here. But I wanted to briefly go over medications that we use for depression. So we have the most common class of drugs that we use are the SSRIs, or the selective serotonin reuptake inhibitors. These are medications such as Zoloft, Celexa, Prozac. We also use SNRIs, which are what we call the dual action antidepressants, such as Cymbalta and Effexor, that work also with norepinephrine. And then we have the atypical antidepressants, such as Wellbutrin, Trazodone. We have the tricyclic antidepressants, which are the old school ones, I call them, or amitriptyline or Elavil. We also use many medications for anxiety. The most common group we probably use are the groups of antidepressants that I just mentioned. And then we also have benzodiazepines, such as Valium, Xanax. And we have serotonin enhancers, such as Buspar, that I think we commonly use sometimes in pregnancy because of the class drug it is compared to the others. So I also want to quickly talk about herbal treatments. They're out there. You should always talk to your doctor before using. They can help in lower doses, but you have to be careful because they're not always safe and do have some risks with using them. So some of these include St. John's wort with depression, anxiety, there's multiple, kava, passion flower, valerian, chamomile, lavender, lemon balm. So there's a bunch out there, okay, that you'll see. So why do medications work in treating anxiety and depression? Because we know that there's chemical imbalances in the brain. And I talk about this daily in the office with patients. Patients are always hesitant. No one wants to be on a medication. No one wants to take anything if they don't have to. But we know there's a reason that these medications work. There's certain brain chemicals called neurotransmitters that are associated with depression and anxiety, particularly serotonin, norepinephrine, and dopamine. These neurotransmitters all aid in the communication between brain cells. Each class of drugs affects these neurotransmitters in different ways. So that's why they work, and that's why we use them. I'm gonna now turn the presentation over to Kassandra, everyone. I grew up with peanuts, so I wanted to throw a little couple slides up here. This one over here on the right, my anxiety have anxieties, I think was me this last week preparing for this presentation and being perimenopausal. So this was very fitting, I felt. I wanted to thank you all for listening. Okay, we appreciate you. Thanks to my patients out there that had to listen to me twice today, maybe. I appreciate you as well. And I want to leave you with one last quote. Okay, I have patients daily that I talk to in the office with regards and ask them how they're doing, and tears start coming down, and I give them a Kleenex. And they always say sorry to me. And I say, if you can't cry with your gynecologist, who can you cry with? So thank you everyone for listening. And I'm going to turn it over to Kassandra.
Thanks, Sue. You know, Sue, is it okay? Can we go? We weren't able to see the word screen. I think it's so lovely. If we could go back to that, that would be great.
Yes.
Kelly, give us 1 second. And I just wanted to add one word, and it came from the New York Times, and one of my patients brought it up today, and it's called languishing. And it's a term for the blah you're feeling, the void between depression and flourishing, the absence of well-being. It can dull your motivation and focus, and it may be the dominant emotion of 2021. So if you can share your screen, I just wanted to add that word in.
We might be able to try doing it at the end, Kassandra. We can pull it back up at the end.
Sure thing. All right. Well, I am Kassandra Maple. I am the clinical therapist, social worker here at IHA. I have the great pleasure of working with Dr. Archer and the great number of physicians at IHA. It is such a pleasure. My role is twofold. It's to do therapy with patients, but also to provide services as much as possible to patients. And that may be also referrals to patients as well. So my role is twofold here. And so I have a great pleasure tonight to talk to you all about depression and anxiety. We have a number of topics that we're going to discuss tonight, really just about an understanding about what depression and anxiety is, how to be able to regulate some of those emotions, and then using emotional regulation skills, and then also the importance of coping skills and some helpful resources. So we're going to start with depression and anxiety. Some signs and symptoms. We use the DSM-5 as a guide for identifying the signs and symptoms of depression. A person may experience a depressed mood for most of the day, nearly every day, and that may include feelings of emptiness, hopelessness, which may be present, as well as some persistent tearfulness. There can be loss of interest or pleasure in activities that you may have found to be enjoyable. One of the things that I often hear patients discuss is they'll say, Kassandra, we're in a pandemic, so there's not much for us to do. So I don't really know if I have lost interest or pleasure in doing things. And so those things have been closed in the pandemic. If there are things that you have found to be enjoyable and they're no longer enjoyable, that may be going for a walk, that could be reading a book. So those basic things that you find pleasure in life in, if they have decreased, that's something to keep an eye on as a red flag. So changes in appetite or weight, so lack of appetite, but also overeating may be present as well. Sleeping trouble, so sleeping changes, and that may include difficulty falling asleep, staying asleep, and then also maybe excessively sleeping during the day. And so, you know, a lot of people are working at this time through Zoom and using that as a platform. And so one meeting may go down, and I've heard patients say, I'm just running to the bed to take a nap. with 4 meetings. And so maybe you're feeling like you're lagging through the day and you're feeling the need to kind of go through sleep in order to be able to cope. Psychomotor agitation can be an issue, and that has restless symptoms such as the inability to sit still, pacing, hand wringing. On the other hand, you may experience a slowing down of thoughts and actions, and even in your speech every day. And other people may have noticed that and given you a comment or some feedback regarding that. There also may be fatigue or loss of energy almost every day, feelings of worthlessness and guilt. Maybe you feel like you have failed, you're not enough, and you're feeling the people around you. You may also have difficulty concentrating on things, making decisions. You may appear indecisive and almost every day. And that could be from, again, subjective reporting from yourself and also from other people. There may be thoughts of suicide or death, recurrent thoughts of death in terms of suicidal ideation without a specific plan. Maybe you're just feeling like, you know what, I don't even want to exist. I wish I could just go to sleep and just not wake up. Or you may even have a specific plan in doing so, in which case that also would be a red flag as a major concern. So we're going to talk about criteria for diagnosing. What I would like for you to monitor in yourself and your loved ones is if you may be experiencing or exhibiting 5 or more of these signs or symptoms, and if they have been pretty persistent over a 2-week period, and if they have impacted your quality of life and living. Are you able to enjoy life and function in the same way? And you may get those screens that Sue talked about earlier at your annual for your physical with your PCP, and they'll give you these screens, the PHQ-9, and they'll ask you, you know, are you having a hard time functioning? And you may say, well, I've heard patients say, well, I'm able to get my things and I don't let this depression or this anxiety get in the way. Okay, well, maybe you're getting through life and you're accomplishing these tasks, but has the quality of your life, has it diminished? Has the functioning of you being able to enjoy your family, has that reduced? Lastly, have you or your loved one felt down or low more days than not, or experienced a loss of interest or pleasure in doing things that bring you joy? The DSM-5 specifically outlines some criteria also for anxiety. And what we understand is that that may also present with the presence of anxiety and worry about a variety of topics, events, or activities. It may appear as edginess or restless. I often ask patients, do you feel like you're kind of on the edge of your seat? Are you tiring easily? Do you feel more fatigued than usual? Are you having impaired concentration or feeling as though your mind is just going blank? I often will have patients say, Kassandra, I feel as though I can't speak. I feel cloudy, like as though there's a fog in my mind and I can't communicate effectively. There may be irritability, which may be observable to you or others, where you may be more easily frustrated or annoyed. And there may be increased muscle aches or soreness in your body. You may find that there's difficulty sleeping due to trouble falling asleep or staying asleep, restlessness at night, or unsatisfying sleep. Maybe there is excessive worry, meaning that there may be no specific threat, but yet you feel as though your worry is disproportionate to what may be happening. Someone struggling with anxiety may experience a high percentage of waking hours worrying about something, and the worry may be accompanied by getting reassurance from other people. And maybe you're relying upon other people to tell you that you're okay or that you're enough. We may also see that there can be a great concern about your job performance and handling your responsibilities. You may have worry about financial matters or everyday typical life circumstances. And people with anxiety may also experience symptoms such as sweating or nausea and even diarrhea. The anxiety and worry and other associated symptoms may make it hard to carry out daily activities and responsibilities. And they may even interfere with your relationships at work and with families and others. I want for you to consider, if you are a loved one have been experiencing ongoing worries, any challenge with controlling those worries, or difficulty managing that feeling of just being overwhelmed? Are you having 3 or more of these symptoms more days than not over a 6-month period? And again, I want for you to monitor how you feel and if these symptoms are interfering again with your daily functioning. So when it is appropriate to access treatment or help. When considering getting help, we look always at how symptoms and how long they occur. However, I do not want you to be concerned with the numbers as much as being aware that if you begin exhibiting these symptoms and these signs, that you notice that these symptoms are occurring over a period of time or over a course of weeks to months that have not been resolved. As a benchmark, if you have been experiencing ongoing symptoms for 2 to 4 weeks, please do not take it upon yourself to do a diagnosis, but to communicate with your provider so that we can get you access into appropriate care, especially if you are experiencing these concerns and it's been an impairment to your everyday life. If your quality of life has stalled because you are not able to function as well as ever, we want for you to coordinate with the mental health specialist or your medical provider so we can discuss those screenings that Sue discussed earlier. If you are beginning to have any type of thoughts of harm, we want for you to coordinate with a trained mental health provider or to create a safety plan. And I encourage you to call the office so that we can make a safety plan for your care. In addition, if you are having urges or having a plan, we need for you to call 911 or go to the nearest hospital room as soon as possible for your safety. On this slide is the National Suicide Prevention Line. Please take note of that number. The National Suicide Prevention Lifeline provides 24/7 and confidential support for people in distress. We know that talking about stress and thoughts of suicide with a trained professional actually reduces outcomes of suicide. Please seek support and keep in mind that passive ideations should not be ignored, but should be considered as a red flag for getting care or therapy. I wanted to go to our next slide here. And this slide is with Oprah, but I'm going to mention something back under emotional regulation and coping skills. These skills that we're going to talk about as it pertains to emotional regulation skills, I'm sorry, Kelly, we're on slide 32. It's okay, you can stay there. So we're going to just go into emotional regulation coping skills. These skills and resources are not meant to be a replacement or a substitute for therapy. These skills can be helpful along with therapy in a reduction of stress. Regulation skills take practice and ongoing persistence because you are literally retraining your brain to learn something new. So be patient with yourself in this process of finding what works best for you. It may not come easy, and you may have to work with a therapist to process barriers to using such skills. Think about it as going to the gym. I never know what I was doing having to go to the gym at all. There's tons of equipment, but we don't know how to use it to get the results that we want to be able to see. We may need a trainer to help us get to the outcomes that we're seeking, and that's what therapy may look like for all of us. So I have this lovely quote here by Oprah. All stress is caused by wanting this moment to be something it's not. I inhale what is, I accept this time for whatever it has to show me. Such a powerful quote on staying in the moment and learning the power of acceptance and that there are some things that we cannot control. Accepting the moment for what it is and what it has to offer. Now, in the chat box, you are welcome to put in here your favorite coping skill or regulation skill. I like to think that we're in a community tonight of learners, and so we're all coming together. So if you have a coping skill or regulation skill that you have found to be useful, I would love for you to put that in the chat box. So we're going to talk a little bit now about how to regulate emotions. Emotional regulation is our ability to control or manage our own emotions rather than our emotions controlling us. This means we must improve our sensitivity to our emotions and identifying our feelings if we seek to manage them effectively. In regulating our emotions, it is necessary that we practice regulation and coping skills regularly before a stressful event even occurs. Stress is inevitable. It is a part of our daily lives. And in many instances, it definitely is outside of the control of what we're able to do. So however, we can take preventative measures, though, to reduce our stress by regularly using regulation skills that are soothing. I often recommend 3 times a day, morning, afternoon, and evening, about 3 to 5 minutes to reset, meaning a meditation or a breathing activity, to reflect, meaning an affirmation, journaling, or a gratitude list, and a release, something that's cathartic, a release of emotion, something like running or yoga. It's important that you practice regulation and coping skills until you find your jam. Your coping skills are only as good as your ability to know how to use them. Create a self-care plan that you implement within the areas of your mental, emotional, physical, environmental, recreational, and social well-being. Make a goal in each area of your life to improve healthy outcomes. Having a support system can be a great help in reducing concerns related to stress, reducing isolation and normalizing some of the stress you experience so that you can know that you are not alone. Finding a support group can help speak to some of your concerns and life changes, like being a new mom or experiencing grief and loss. It's important that you define healthy boundaries for your life. This is my favorite thing to talk about in therapy. If anyone has worked with me, you all know let's talk about boundaries, okay? And so it's important that you prioritize your well-being. In doing so, you are not being selfish. Let's say that again. You are not being selfish. Rather, you are teaching others how to treat you and honoring the needs of yourself so you can give back to others in an optimal way. Saying no is healthy, okay? Especially if your plate is full. Understand many times stress related to anger and resentment may be your cue that a boundary is being crossed, and you may need to enforce that boundary in the future. I want for you all to create a philosophy around acceptance and one that validates the reality of your feelings. So we're not going to dismiss that sometimes something is going on hard, something that may be happening isn't challenging. It's okay to validate that. So it's okay. I want for you to maybe think about a mantra that may say, this moment is hard and this moment will pass. So in our next slide, we talk about improving emotional and feeling awareness. And so this is often something that I have patients do. And I ask patients to scale themselves 0 to 10, 0 being the max of your depression and 10 being the max of your anxiety. 5 is in the middle, which is your home plate for you being able to feel like you can cope as well as ever. 5 going to 0 is moving toward feelings of sadness and depression. And 5 going to 10 is moving toward feelings of anxiety. You can use intervals on this scale like 3.5 to indicate levels of sadness or 7.5 to indicate levels or feelings of anxiety. And you can also identify numbers on both sides of the scale at the same time. Identify your feelings and physical response. So I want for you to think about your body telling you a story. So if you're having headaches or tension in your body or you're clenching your jaw or fist, that may be a sign that you may be experiencing some form of dysregulation. For example, if you let out a huge sigh, that could be a cue that you've been holding in your breath. You may need to identify your emotions and then scale yourself. So scale for the intensity of your mood. The closer we are toward our max, the more we may need a cathartic release. We may need to go for a run with music, yell into a pillow. We may need to follow up with that with some deep breathing. If you are feeling more hyper-aroused, you may find shorter inhales and longer exhales beneficial. And if you are hypo-aroused, you may find shorter exhales and longer inhales helpful. Perform an actual regulation or coping skills if you're not at 5. So anytime you become aware that you're not at 5, you may want to do more than one skill to get back at 5. So one skill may not do the trick. You may have to do more than one. And then you want to rescale yourself to see if these skills were effective. In other words, did it work? This tool is effective for patients becoming more aware or sensitive toward identifying their emotions and feelings. Many times we may not be cognizant of our emotional state, and we may need to slow down to become more aware of how we are feeling and processing our emotions. Have you ever eaten a meal but never focused on how it tastes? And then that could be the same also with our emotions. We kind of just function without processing or noticing. This skill allows for you to take inventory of your emotions. So you can talk and ask yourself, what do I need to give myself in this moment to regulate? Do I need to take some breaths, a brief walk at work, to do some journaling, to put some words about how I feel? By checking yourself, you can use it as a problem-solving technique through stressful situations. If you know you are a 7 or at an 8, you may want to wait before having a difficult conversation or a hot topic like finances with your partner until you are more regulated in a relaxed state. Breathing techniques. One of my favorite is the hand over heart technique for your breathing. And I know some of you at home have children, and so bubble breathing can be effective as well. So you may want to actually take some bubbles and breathe through and practice your breathing with bubbles with your children around. You can also do penny breathing by putting a penny on your belly and watch your stomach go up and down with your children. And then there's the crossover arm breathing where you bring your hands into a cross, put them on your chest, and do some deep breathing as well. And you can use a count by breathing in slowly, hold your breath, slowly count to 4 as well. You can create a nurturing voice, and you can implement by implementing positive self-talk. Think if the situation happened to you as a child, think about if the situation happened to your child or your friend, how might you respond? Oftentimes, we may find that we are kind toward other people more than ourselves because our inner critic may be very loud or harsh. You can create a mental or a safe space. Think of a time or a memory where you felt safe, and maybe think about a person who makes you feel safe as well. And the details of that environment include your senses like taste or smell to enhance your visualization regarding that event. And think about taking some breaths in that moment in order to reset yourself in the moment as well. Movement can be very effective in reducing stress, as Sue has already talked about. And always keep some type of affirmation for yourself to reduce stress, like now is not forever, or I am enough and I am worthy. The 5-4-3-2-1 technique is probably one of the most popular techniques and widely used techniques, but it's also a very effective technique. And the 5-4-3-2-1 technique is a grounding skill that involves using your 5 senses. And in other words, you use your senses to take your focus away from unwanted emotions that you may be experiencing, thus helping you to stay focused on the present moment. Start off by mindful breathing. Take a deep breath from your belly. This will allow you to slow your thoughts down and help you to relax. And begin to take note of your surroundings. Acknowledge 5 things that you can see. Look for those things and pay close attention and focus on them. For example, a pen, a picture. Notice what you see, the color of an object, the shape of it, and what it means to you. Number 2, step 2, take note of 4 things you can feel or touch, such as your desk, the wind against your skin, your nose, your hair. Pay attention to the sensation of the thing you are feeling. Is it cool or is it warm? How does it make you feel? Notice 3 things you can hear. Listen and take note of what you hear around you. The wind, the traffic, the playing of music, people walking by. Listen to all noticeable sounds as much as possible. Step 4, pay attention to things you can smell. Notice fragrances that you may be picking up in the air, such as perfume or cologne, or smells in the kitchen. Think about scents. If you can't smell anything, scents that you may find to be very pleasant. Step 5, focus on the thing that you can taste. Notice the taste in your mouth. Maybe it's the aftertaste of milk or coffee that you had earlier in the day, or a pop or a stick of gum. If you aren't able to taste anything, again, think about something that is tasty. Now, take another deep breath from your belly, and you should be feeling a little calmer. If you're feeling still a little anxious, you can repeat the exercise as many times as you need to. Now, we all have coping skills. And what are they? Coping skills are strategies that we use to deal with stress, problems, or uncomfortable emotions. And we have unhealthy coping strategies, and they often give us instant gratification or relief, but they have not so good long-term consequences. In contrast, healthy coping strategies don't always feel good in the moment, but they do contribute to long-lasting positive outcomes. Healthy coping skills may be exercising, therapy, problem solving, right? And unhealthy coping strategies may be overeating, procrastinating. We want everyone here to focus on the healthy coping strategies so that we can see positive outcomes. In our next slide, we're going to go over types of coping strategies. And I see that you all have put some in the chat as well. So distraction techniques allow for your mind to become absorbed by something else, which can help you distract from ruminations that maybe you're caught in. Grounding techniques are a form of mindfulness, which allow you to become more present in the moment. These skills can shift your focus from your thoughts or your feelings into your body so you're able to focus on your senses. By shifting your focus to something else, your thoughts and emotions will follow, which can reduce your stress and anxiety. The other skill on here is also emotional release. And so we discussed some of that earlier, but that's when you can find something that is very effective in allowing your emotions to be released. So that could be taking a cold shower or crying into a pillow while holding on to a soothing object. So all those on there are things that can be done as a coping strategy. Self-love or self-soothing activities can be very helpful. Getting a massage, taking a bubble bath, taking a long shower, buying a small treat. I'm not encouraging you to buy objects and things. I don't want for you to leave here and say, well, but the therapist on here said that we can just go shopping. I'm not saying that. You can buy something small or a treat that you think is effective to reward yourself after something that may be a stressful activity. A thought challenge may be very helpful. So writing down negative thoughts and then next listing the reasons that they may not be true. Accessing your higher self, that can be very effective too. So volunteering and doing something that's very helpful. I had one of my patients during the pandemic when it was very stressful, we did not know that it was going to be this long, begin to make masks for people before it was really even mandated. And she was making them for her friends and her community. And that helped shift some of her anxiety during that time period. So there are things that we can do such as that can be very helpful. So we have a small video here on challenging negative thinking.
Negative thinking is one of the biggest obstacles we face in experiencing more happiness. But there's hope. Here are 2 strategies based on cognitive behavioral therapy to defeat your The first is to distract. When you're heading into a social gathering and you begin to wonder, what if I don't connect with anyone? Am I even likable? Do something that lifts your mood. Generating a positive emotion will counteract the anxiety you feel. Listen to a song that makes you smile, or take a moment to appreciate people in your life who love you. Positive emotions literally undo the effects of anxiety by lowering our heart rate and muscle tension. We often believe that our negative thinking is true, but in reality, our minds feed us messages that range from mild embellishments to outright lies. Here, we might prefer to combat. Imagine yourself in court. You are the prosecutor and your negative thought is the defendant. He's guilty and you know it, but he's pleading not guilty and sticking to his story. Your task is to get the judge to hear your side. So when the negative thought shouts out, "You're not good enough at your job," you need to consult the evidence you have at your disposal to prove it wrong. Argue back with the strongest piece of evidence you can find. For example, "I am good enough because every performance review I've had has been positive. I'm currently being considered for that promotion, and my boss told me last week how much she enjoys working with me." Bring your best version of a tough lawyer to that courtroom and convince the judge that the negative thought doesn't deserve his or her attention. After all, the judge is you. Both of these strategies, distract and combat, are skills anyone can learn and get better at with practice. Remember, with each negative thought you defeat, you've successfully earned your own happiness.
We're coming close to time, but you guys had some really great things in the chat. So walking, going to the gym, walking with dogs. Someone noted journaling, prayer, yoga, painting, setting boundaries. You already know that that's my favorite. Daily meditation. I like someone who included a really nice mantra, which was, I found myself saying in my head, "I am calm and in control," over and over. That was really lovely. Snuggling with my puppy, that's a great one. Taking lots of bubble baths. I think that that's great and a great self-soothing technique as well. So resources, that's what it's all about, being a social worker. So I'm gonna give you some of my handy dandy tools in my toolbox. So meditation apps have been great because, a lot of people are not really always in favor of meditating. Like, Kassandra, I cannot do it. So I'm always saying, okay, that's fine, but maybe use an app that can help you learn how to meditate. So you can use these apps, Headspace, Calm Act, and then a Expectful app. I was turned on to that by a patient. You can use for regulating that when you're pregnant, or if you're trying to become pregnant, and if you're also postpartum, and they can do that. They go across trimesters for certain meditations for you to use. So what's cool about these is that you are able to have a guided meditation, and some of them are timed. What I want for you to focus on is that they do come with the payment, but you may find that payment or that subscription could be very much so worthwhile. I don't ever recommend, and there are free ones on YouTube, that you do a meditation that is for 10 or 20 minutes. If it's your first time doing meditation, please start small and then go up high. Start maybe at 3 minutes or 5 minutes, but don't do 10 minutes or more, especially if you're not used to doing meditation. The next thing that we want to talk about as a resource is finding a therapist. How do you do that? So you can call your insurance, and it's usually a number that is listed on the back of your insurance card. Your insurance may direct you to a number of providers that are in your network and will cover your care, or you may need to verify your insurance or a provider with your insurance to make sure that they're included in your selected plan. When selecting a therapist for treatment, most will use an integrative approach of many different modalities to assist you in treatment. Specifically, mindfulness and cognitive behavioral health approaches have been evidence-based and effective in treating anxiety and depression. For many clinicians, you can review their backgrounds, expertise, and training on their profile. Finding the right therapist may take time, but there is much power in the power of relationships. So do not become discouraged if you have not found your fit just yet. The connection in that relationship is just as important as the tools that are provided. So please consider and discuss your expectations and boundaries upon entering into a therapeutic relationship. I also want to make note that you can also find and use Psychology Today and go and find a therapist. These are websites. And you can also use Therapy for Black Girls, as well as Open Path Collective, which offers low cost and reduced rates for psychotherapy. Here are some of my favorite books that I discuss in therapy, and I often make them homework for patients. And so my favorite on here is The Gifts of Imperfection. So if you're having struggles with your inner critic and vulnerability, that's such a great book to work out, especially when we have core beliefs that may be rooted in affecting us having thinking that can increase our anxiety and depression. Last but not least, we have here our next set of books, which is Practicing Mindfulness here and Cognitive Behavioral Therapy. So those are additional workbooks that you can use and meditations that can be helpful. The last quote that we have here is by Tracy Ellis Ross. And she says, I need to see my own beauty and to continue to be reminded that I am enough, that I am worthy of love without effort, that I am beautiful, and that the texture of my hair and the shape of my curves, the size of my lips, the color of my skin, and the feelings that I have are all worthy and okay. So if no one has told you today, you are enough and you are worthy. Thank you for listening to our presentation this evening. We're open to taking questions.
Kassandra, it looks like there is a question in the Q&A section. Is Kassandra Maple taking any new patients at this time?
Yes. We will do our best to assist you for sure. Yes.
And I think you have been following the questions along in the chat. Someone asked if we do any more of these presentations. We do offer Wednesday Wellness for Women monthly. You can follow the same registration link for any that are currently planned, and also stay tuned to our website. If you have registered for this event once, you will get an email when new events are being posted. So now that you are in the Wednesday Wellness for Women registration group, when we do post new events, you will get that email. Also, following this presentation, we will be sending out the slideshow along with a survey and the recording of the presentation, so you can refer back to it. Our website is IHAcares.com. If you are looking for any appointments with any of our physicians or social workers, specialties, PCP, we are there to serve our community. And also, following up this event, we will provide the information for any of you who are parents trying to parent through the pandemic, through anxiety and depression. Our upcoming event is going to be in May, and that will come out with the registration information following this link also.
I wanted to just make note, Kelly, someone asked, what do we recommend if someone doesn't exercise well? Is that okay if I answer that, Kelly?
Absolutely.
So what I would say is progressive muscle relaxation techniques can be good for you just being able to use that tension in your body. So you're going to kind of squeeze in throughout big parts of your body, so your arms and your legs, and then kind of recoil out with deep breaths as well. So you can find those exercises as well on YouTube. I didn't make mention of it during the presentation, but progressive muscle relaxation can be very good and relaxing too. And Sue, did you have any other recommendations if a person's not able to exercise well? What do you recommend?
No, I think that's great. I was just reading ahead and looking at some of these other questions, Kassandra. One is about weight gain, which is tied to this, and how many women are struggling with weight gain during the pandemic. It's tied to my self-worth. Absolutely. I've gained 15 pounds. I'm working on it, but it does affect my mood is a question. I think the weight gain has been a struggle for everyone out there, guys. And I don't have a quick answer. I don't have a quick answer for it, except that I think it's important. I mean, getting a step tracker. And I getting one of those and seeing how many steps you're doing, it was drastic with the drop in steps people saw through this pandemic. So getting that step tracker to actually see your steps you're doing. If you are stepping through your house over and over and pacing, you're going to get your steps in, you know, and now it's weather's nicer, getting outside. I think the stepper is a big thing just to help with the minimal activity. But you're absolutely right. It's hard to get over that hump, but once you start exercising again and get over that little hump, it'll help. You'll get.
People want to see the word map, Sue.
You know, so I'm going to attempt to go back in here and share my screen, and I'll do that. But I wanted to look at, there's a lot of questions here, guys. I'm trying to look at them.
Okay.
Is it common that doctors talk about side effects of medications for anxiety before they recommend them to patients? Yes, typically we go through the pros and cons. We should be going through the pros and cons of different medications. Trying to answer that one, guys. There's certain ones that have more side effects, I think, than others. And I think dependent on the patient, they affect everyone differently. So it's really hard to find a fit for a medication. Sometimes we just have to try different ones. We always start at a very low dose, and there are certain ones that are harder to get off of. So yes, we can help to get you on one that's easier to get off of if you need to come off of it. So definitely something that can be talked about in the office. Kassandra, do you want to look at those? I'm going to see if I can go back and share my screen and go back to the word slide real quick.
I just realized, okay, I see this now. All right.
Yeah.
It says, what do I do if I'm anxious to take anxiety medication? I'm worried about side effects, medication, making me not feel like myself, I'm having suicidal thoughts. So I would probably say you want to go into the office. You really want to do those screens with you if that's happening, right? If you are experiencing anxiety, we can use those screens to have a conversation with you about whether or not medication may be effective, or having to just kind of go into therapy and using that as a strategy. The provider can discuss with you side effects if necessary, but sometimes if we are experiencing very intense anxiety and depression, sometimes we find that coping skills may not be as effective, and medication can be helpful in taking the edge off of that anxiety and depression, so that CT skills and regulation skills, et cetera, can be more useful for you. So,
yes. Oh, go ahead. Go ahead.
So when would Dr. Archer be opening and accepting new patients at Livonia location that she mentioned? That's a great question.
Of course. I answered always to someone else asked that. Yes. I'll be starting there May 17th at the new location. So soon.
Will the workbooks referenced tonight be in the email? I couldn't write them down fast enough. I'm so sorry. If they're attaching the email, they're going to be a part of the presentation, so you'll be able to see that as well.
The question about, do you have recommendations for anxiety and depression related to medical conditions? Obviously, that's a hard one, because helping those medical conditions, I think, first, and then helping the anxiety, depression is second. So it depends on what medical conditions. It's hard for me to really answer that. You know, I have patients that have medical conditions that I don't manage, but then I ask them, are they depressed about this? Because definitely women I see get depressed over conditions that they're having going on. So I may not manage their medical conditions, but I definitely still talk to them about their depression around it and can help with it. So I think it just depends on that question, guys. I think someone asked about Lexapro. I think Lexapro is a great medication. I use it commonly with patients. So I think it has different side effects sometimes than the other class with regards to the other medications in its class with regards to Prozac and Zoloft. But it really comes down to, I've had patients that try one medication and they don't do well with it, and we have to switch them to another medication in the same class. So it just, that is in the most common class of drugs, and I think is a great medication. So.
Someone asked you, are you allowed to have a drink or two on Zoloft?
Yes. You are okay to do that.
Someone asked, what comes first, physical symptoms or anxiety? I would probably say it's our mindfulness of kind of being aware of our body. Sometimes our physical symptoms help alert us that we may be experiencing anxiety. So one may not, it may not be the chicken or the egg. It just may be about what we're noticing in the moment. And how we're becoming sensitive and aware to what's happening with our emotions. But we may be checked out, and we can use our physical signs and symptoms as a way to help us check in. So there's for you. Go ahead.
Someone asked, do you still deal with hormonal ups and downs monthly when you were 63 and done with menopause? That's a great question. I think that depends when you went through menopause. I have some 59, 60-year-olds that still were having periods and finally stopped. So I think a couple years after that, I expect to still have some ups and downs, but that I typically don't see it cyclic like that. It's usually more continuous at that point. I think mood swings are very common with menopause and perimenopausal patients. So that is more of an up to down. So that the mood changes. I think we can maybe think of hormonal ups and downs, but I think that's more of mood changes that can happen. And I think that that is something that can be addressed definitely. I hope that helps with that answer.
Someone said, are there any alternative treatment therapies besides just taking medicine? Yes, there's therapy. So we want for you to find someone, if you are experiencing anxiety or depression, who is a trained therapist. And so like I mentioned earlier, cognitive behavioral therapy and mindfulness have been found to be very effective, but there are other modalities that a therapist may have that can help reducing concerns with anxiety and depression. But depending upon what your concerns are, that's why it's important for you to come in to discuss your concerns with your doctor. We may decide to even refer you over to a psychiatrist. And if I wasn't clear, yes. So CBT is cognitive behavioral therapy. We may refer you over to a psychiatrist for a full evaluation if necessary. So if there are other diagnoses that may be happening or occurring, you will be in the appropriate modality for that. So if patients have experienced post-traumatic stress disorder, you may say, let's find you a therapist who's had a training in EMDR, depending upon the type of concerns that you may have. So it's important that you come to your appointments and discuss those issues that you are having so we can direct you in the appropriate way.
Is it harder to lose weight once in menopause? It definitely is. I had that conversation at least twice today with patients in the office. Trying to lose weight with hormonal changes that happen once you're in menopause. I think it really happens within those first 5 years after you stop your menses that we see it most commonly. That is a real struggle, and then your body kind of evens out, but definitely it's harder to lose weight. And I have to talk to patients about multiple different types of diets to sometimes try to switch it up, try a different exercise. I have to attempt different things we try and talk about in the office. So, but yes, there's truth to that. Can we answer the, what's the best way to find a therapist and psychiatrist through IHA?
Oh, I didn't see that. I would say typically you speak with Sue or your provider, your medical provider. They typically will do a referral over. We're in the OB-GYN division, so they refer over to myself, but every patient I see is not my patient. And so it's important that goodness of fit happens. And then what we can do is we can refer you over to someone. There should be within different clinics, hopefully a behavioral health consultant that can direct you over to therapy. But also you can go on some of those reference pages that I noted earlier to find a therapist as well. Hopefully that answers the question. So is there anything that I'm missing with that?
No, definitely. And the your internist can also, we have a huge list of therapists we refer besides Kassandra. And I will say that we are hiring another one to help. Kassandra's been mainly involved with most of our obstetric patients through our department. And we are actually hiring a second Kassandra this year, which is wonderful. And so we'll have someone to help more with our gynecology patients as well. So there's more to come with that, everyone. But yes, your OBGYN or your internist can help you. Definitely. We have lots of suggestions. Someone asked, is it common for women to go from postpartum anxiety or postpartum depression anxiety to 2 years later perimenopausal anxiety and or depression? Yes and yes, and yes for treatment possibly as well. Very common. Those are risk factors definitely that we see through the life stages. So absolutely, definitely talk to your OBGYN or your internist about it. And we do have suggestions to help. Sometimes it's hormonal related and we can help hormonally. And then sometimes, so when someone asks about medications, a lot of times trying to adjust your hormones a little bit, dependent on, there's a few things that we can do to help with that. Can also help with anxiety and depression.
Someone asked, does COVID have anything to do with a chemical imbalance? I've never experienced anxiety until COVID. Do you want to answer that first, Sue?
Sorry, I was trying to type in a quick answer to someone else's in there, guys.
Okay.
Say that one more time to me, Kassandra. Sorry, I was
It
looking.
says, does COVID have anything to do with a chemical imbalance? I've never experienced anxiety until COVID.
I'm assuming you're asking if, not that you've had COVID yourself, but maybe you are. And I don't know I know that patients that had COVID themselves did experience many symptoms with regards to anxiety and depression. There were studies looking at patients that have had COVID. Okay. And I don't think they know the link to it, but there are studies that have shown that. But I think the pandemic itself could definitely give someone anxiety. There's no question. And whether that means you're going to have anxiety for life, or is this just a situational type of anxiety, I think is the difference there. And I think we've all experienced anxiety through this pandemic. And so I think it's very common and at this point, so definitely something that can be talked about. It doesn't mean it's going to be for life, okay? But I think talking about it and sharing the feelings is going to help. And I think that's where the therapy can come into play a lot. And I know patients are very afraid of therapy. Kassandra's very innocent and very nice. And she will happily take care of you, but so are all the other therapists that I refer patients to. So I know it's scary and there is a stigma, but I don't want people to be afraid of therapy. It's very important.
Sure. Someone says, how do you determine that your therapist is a good fit for you? You said it might take a bit to find one, but how do you know? So I would say, I always ask if patients have been in therapy before. If they did and they dropped out of therapy, what happened? Was it something that the therapist did or said? So maybe you already know that there were some things that maybe were uncomfortable previously. And so it's good for you to be able to come in and talk about what expectations that you have. If you're leaving a session and something feels amiss, where maybe you're not saying something, it's better to kind of go into therapy talking about what that concern was. And so, you said this last time, I wasn't sure why you said that, and kind of be able to bridge some of those concerns versus keeping it inside. And so that can help the therapist understand what your concerns are to kind of better build rapport with you. Goodness of fit is one of those things that may come in terms of over time, even just feeling safe and comfortable. I think that there have been things that patients have said over time, but I would say that it's difficult to just say that but I would say that if you're in an environment where you begin to feel safe with that environment, safe in that environment, and you feel like you are heard, that you are seen, and that you are understood, those are the three qualities that would be important for a therapist to have when you are leaving the session with them, that you feel seen, that you feel heard, and that you feel understood. Those other questions said how to deal with a fight or flight moments like body shaking that come up with anxiety. If that's happening, a lot of times with that that fight part that may come up, or that flight part that may come up when we're feeling anxiety, or really that's more so being hyper aroused. That breathing technique that I talked about before, where you're having shorter inhales, longer exhales, can be very effective in being able to process that. You may want to talk to a therapist for additional coping skills so that we can understand what's happening in those fight and flight moments. If there's something that may be affecting you, to kind of tease those things out, as well as some more coping skills. So there could be some things sometimes when we're experiencing those moments, we may actually be triggered by something. And so we may need to have a deeper understanding of our triggers so that we can deal with that in therapy to have some more effective coping strategies.
Thank you, Kassandra and Dr. Archer. It is 8:20. We're going to go ahead and wrap up our Q&A session with our providers this evening. Again, you will be receiving an email with a survey, as well as upcoming event information and a copy of tonight's presentation. We do still have access to questions after closing out the event, and we'll attempt to answer some of the more repeated questions with the follow-up survey as well. If you have any questions or looking for an appointment, again, visit us at www.ihacares.com. We have several providers that are ready to serve you. Thank you. Have a good evening.
Thank you.